everyone, to today's session on Can We Talk About This in Private, led by Matt Bronheim. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to Matt for this continued partnership. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. For those of you watching live, if you have any questions related to today's program, please feel free to utilize the chat feature throughout the session. At the end of the session, your questions in the chat will be used to moderate our question and answer. If you have any other questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the presentation over to you, Matt.
Hi, everyone. Thanks for having me. My name is Matt Bronheim. I'm one of the social workers here at Dana-Farber. I work specifically with the GU team, so I see majority of patients who have prostate cancer, bladder cancer, kidney cancer, and a few others. But prostate cancer is a very large part of my work. I just wanted to give a quick introduction, kind of how this talk came about. Prostate cancer treatment has a huge impact on sexual functioning. It often goes underreported or not reported at all. It impacts people really differently as well, and it can feel really isolating when it's something that's happening to you and you don't feel like other people are experiencing the same thing. Um, Even outside of someone talking to, say, a doctor, people don't talk about it with their partners either. They feel like it's too sensitive a topic and they don't really want to talk about it with their providers, their partners, their family, anybody, and it could become, you know, a pretty big weight on people's lives. So my goal of this webinar was just kind of give some information on some basic treatments for how we help with sexual functioning, and also maybe some tips and strategies to talk to your doctor about it. So I have no disclosures to make, no financial ties or any conflicts of interest. But I thought a good place to start would be, what are the different types of prostate cancer treatment that are out there? I would say a majority of folks have some combination of these three things. They all impact cancer, or they all impact sexual functioning differently. And depending on your cancer scores or your type of cancer you have, they might be recommended to have one of these treatments. The first one is surgery. And what is kind of expected from it is erectile dysfunction pretty much right away. Lack of ejaculation, orgasm changes, or penile shortening. And then it can also impact some other aspects of your life, such as urinary incontinence. This is one of those treatments that might take longer to recover, but it often will kind of linearly as time goes on, it gets a little bit better. Radiation is similar in that the symptoms might be similar, such as the erectile dysfunction or decreased semen volume, but it's one of those things that as time goes on, this one gets worse. But the trade-off is there's less upfront cost of recovery. It also might cause some bowel or urinary irritation and some fatigue. And the third is ADT, which is the hormone treatment, which can cause a loss of libido or erectile dysfunction as well. And it can also impact your mood and energy levels. They're kind of all different in some ways, and ADT is often considered like an off switch where it basically turns off any sexual drive, and in turn it does help treat the cancer. So how do we fight back? There's a lot of different treatments out there that we can help with sexual functioning. Probably the most famous one is something like Viagra. It's a medication that ended up helping people maintain erections and for longer. There's also some other ones such as Cialis, Levitra, and Stendra. There's also something called ICI injections, which are intracavernosal injections. And they're basically medications that are injected directly into the penis. Surprisingly, most people probably won't believe me when I say it, but there's often very little or no pain. And they can also be very, very effective. And these kind of treatments escalate in how invasive they might be or how serious they are. So starting with a pill might be a good choice, and then next changing to an injection if that doesn't work. And then after that, we can try something like a device or an implant. So like a vacuum erection device or a penile implant, which would require like, more of a procedure. Um, but they all have very various levels of effectiveness, and it might be something to consider kind of on this road. And there are also a lot of other things we can do aside from, medication or medical interventions. Um, so some of them is behavioral changes. So it's often talked about a lot for most health concerns. Diet and exercise is actually a really, really effective way of treating erectile dysfunction. So the American Cancer Society recommends about 150 minutes a week of aerobic exercise, um, as well as some diet changes. So eating things like fruits, vegetables, and whole grains is often really, really effective. And the reason for that is it's oftentimes just related to blood flow. If it's not something you've been having for a while, if you haven't been able to sustain an erection or have sex for quite a long time, your muscles can get fatigued and it might take a while to rebuild kind of what was lost. And sometimes it starts with blood flow, having your muscles and your body used to that exercise and that movement might make a huge difference in your ability to have sex. There's things like pelvic floor exercises as well, which are, specially designed to strengthen those muscles, especially after something like surgery where your body's been very vastly changed. Um, Another suggestion is also counseling and the psychosocial support of these things. You know, Depression impacts libido. People talk about, performance anxiety or the idea of if I'm not able to, have an erection or if I'm not able to do something, it's going to be really discouraging or disappointing. And that and sometimes can become a feedback loop. And when that happens, it can become harder and harder and harder to kind of break through that barrier to having sex. And as well as oftentimes it's really effective to talk to your partners about it. There's a lot of grief and a lot of distress that goes along with a cancer diagnosis. And outside of that, the loss of the ability to have sex can make a huge difference in people's relationships. It can really cause a lot of resentment to build. It can cause fights. It can cause frustrations. And it might make you less likely to want to have sex with someone. And oftentimes that's one of the ways that people feel most intimate and connected to each other. Um, and some other suggestions are things like sensate focused activities. So these are ideas that are, activities focused around touch. It doesn't always have to be sexual touch, but just actually interacting with the person, finding out what feels good to them, how they like to be touched, how they like to be intimate, and it can focus a little bit more on being in the moment with your partner and as opposed to just focusing on sex. Um, these kinds of things often provide a lot of structure as well, you know, especially when someone has been suffering with this for a really long time, feeling like they don't know where to start. How do we get back to this? Um, and it gives a chance to bring some structure in. You have an activity to work on. You have steps to this. It's a little bit more scripted, which takes a lot of the burden and effort off of you to come up with things. Um, so it's something that can be really, really effective. And a big part of this is finding out how partners can work together. Oftentimes, one of the more disappointing parts of sexual dysfunction is the idea of spontaneity or being able to just say, let's do it, let's go have sex, let's go have fun. It's a little more lost, and that can be really hard for folks. It feels like it's supposed to be spur of the moment, but oftentimes planning it out ahead of time can make a really big difference. It can reduce a lot of frustrations or one side of the, partnership really wanting to be spontaneous or being really in the mood already, and the other side not being that up for it right now. It gives a chance to go over what you'd like to do or what you'd like to try ahead of time, and it brings up a lot of teamwork so it doesn't feel like you're dealing with this problem alone. Another big part of these things is communication. So talking about what's changed, talking about what's bothered you, talking about what you miss most can often bring a lot of closeness to couples who are really struggling. It gives a chance to also talk about what things are working and what things aren't. If you felt like half the time you were really, really into something or it was really working and you were having a good time and then it was lost, it doesn't necessarily feel like it was an entirely failed effort. Having a chance to go over it and break down what was working, what was fun, what was enjoyable can help make communication a lot better. Um, Oftentimes, also not focusing on the outcome of these things. It's supposed to be time spent together. The outcome being sex might be the preferred outcome, but it doesn't mean there wasn't something worth doing in that meantime, especially when you know, sex is oftentimes, as I've said, a really important way people stay close to each other. Just making the effort towards these things can do a lot of good. And it's also important to make time for, emotional intimacy during this time. Spend time during the day with each other that isn't entirely focused on sex. Spend time sitting with each other, hug, kiss, talk, you know, have some time to work up to these things or have at least some space where you can be close to someone without expecting or hoping for sex. A big part of this, I also really think is important to say, is that everybody really is different. We've talked about different treatments, we've talked about different medications, we've talked about different strategies. What helps you and what impacts you the most might not help another person. Think about what changed in your life. Think about what's important, think about what bothers you, and think about what the image of yourself is. When you thought about either who you were before cancer treatment or who you'd like to remain being, really focus on those aspects and dig deep, and it might bring up a lot of good, and it might offer a nice strategy and a nice game plan for what you'd like to work on. Just going in saying, I just want to be like it was before, but not thinking about what that really was before makes it even harder to find a solution. Um, and it's really important to try things often. The first thing might not work for you. The second thing might not work for you. But if you're trying newer and newer things or combining different efforts together, whether it's exercising and trying a medication or trying the injections and diet changes, some combination will work and make a difference. You just have to be prepared to not get it right the first time. And, I wanted to spend a few minutes just kind of acknowledging how difficult this conversation really is to have. It's a really awkward thing to bring up to others. Oftentimes, people don't talk about sex with anybody but the person they're having sex with. And having these struggles can make it seem like it's an impossible thing to get over. It's something that challenges people's identity and brings up a lot of grief and loss of things they lost due to cancer. I have a lot of patients talk about, what cancer took from me. And when this comes up and it's something that was taken and it's really private, it can make people feel like they're really alone in this. And I'm always really worried about that when it happens. And to ask for help, it requires people to be vulnerable. It requires people to ask for strangers about something that they have never talked about before. And in some ways, men are even less likely to ask for this kind of help. Already, we know that men reach out less for assistance with physical changes and mental health counseling. And in some ways, this requires both. So, having a society that's really focused on kind of men can handle this themselves, and this is what a man should be, challenging that aspect can cause a lot of obstacles to get in the way. And I also wanted to take a few minutes to talk about quality of life. Quality of life is something that I feel like oncology focuses on really, really heavily. We're often treating more than just your cancer. The goal isn't just for you to be cancer free. Our goal is for you to have a good quality of life. And only you know what that means. If sex is a really big part of your quality of life for you and your partner, it's important. It's not just something that was lost that we just have to say, it's gone. It's a way people stay connected to each other. It's a way couples interact. It's something fun. It's pleasurable. It's something that really builds up a lot of people's self-esteem and identity. It's what people want to be is often someone who has sex. It also can impact, things like dating. If someone feels like they're not able to have sex or that this is a really big barrier, they might be less likely to go on a date. They might be less likely to socialize. They might feel it's not worth doing these things, knowing that at some point, if sex comes up, it will be a disaster. And they just end up not doing it. And that's quality of life. That's really the basis of a lot of our care here. It also impacts people's self-esteem. Prostate cancer treatment often changes people physically as well. Whether it's weight gain or, gaining fat and losing muscle, you know, energy changes, mood changes, pain, and sexual changes, it can really impact people's self-esteem. You know, it if it feels like it's taking up so much of your life and so much of your thought about how much has changed because of cancer treatment and how much sex is important in your life, it really is a sign to reach out to us. It's a sign that maybe it is the right time. When you're spending most of your day thinking about this, it means it's important and it's a conversation worth having. And, I also wanted to just acknowledge things that patients have told me. There seems to be a lot of themes around this discussion that I have with folks. And my hope is from watching this that you feel like it resonates with you. One of these things or something that was said really resonates with you. And I just took a little snapshot of some of the ones I found really powerful and really important. So people have often told me that, this is the price of treating cancer. And in some ways, it's such a powerful statement about people needing to pay or a cost to these things. It's the idea that once you give it up, that's the end, right? The conversation stops here. There's no treatment, there's no going forward. This is just the way it is. And without knowing that it's not, it makes sense that people feel this way. Not knowing that this can be treated or it's something that we can help with, it feels like this is the way it is, such is life. And it's something that can become really discouraging to folks over time. Another big thing people often say is, I don't think of myself as a man anymore, or I don't think of I'm a man anymore. And, people often compare prostate cancer treatment to menopause and the idea of, this is the end of who I am sexually. And that idea also plays a huge role in people's lives. It's changed their identity, it's changed their self-esteem, it's changed their values by treating this cancer. And knowing that there's a path out of it can make a huge difference. Another thing people say is, nobody told me it would be this bad. Or they felt like if they knew that this was going to happen, they might have picked a different treatment. And you can really sense the hurt that goes along with this statement. The idea that if I knew, I wouldn't have done it. And going back to that idea of quality of life, it really resonates that it's more than just treating the cancer. And if patients don't know that there's a way out of this, there's something we can do, there's a place to go, it feels like they were betrayed, right? It feels like their cancer betrayed them, their family betrayed them, their doctors betrayed them. It feels like it's just them. And the last thing I hear so often is that they don't want to waste their doctor's time with this. Doctors are so busy, they see a lot of patients. I'm so grateful to them. I don't want to take up a lot of their time. And this one always bothers me especially because you really are just as important and valuable as every other person that we see. You're just as important as the doctors, as the other patients, as you, as your family. You are important and valuable, and your time is important to us as well. You're not wasting our time. You are our time. So I thought, with all that in mind, it might be a good idea to talk about why it's important to talk to your doctors and how do you talk to your doctors. So I thought I'd start with, we want you to bring this up. We really do. We don't know what's bothering you if you don't tell us. Some patients don't mind. They might be at a stage of their life where sex doesn't matter as much, or maybe it never has in their life, or they're doing okay with it and they're managing it on their own. But we don't know. We can't assume that this is something that you want to talk about and it's something that is really bothering you. Your doctors also know your treatment specifically. We know exactly what kind of cancer you have. We know exactly how it was treated. You know exactly what your other comorbidities are, what other things you're dealing with that might change recommendations. A good example is if you have really low blood pressure, taking Viagra might not be a safe solution. So letting us know this is something you want to pursue, we can work together to find a really safe and effective solution to this problem. We also have a lot of programs that are accessible through referral. Talking to us about it might give us a chance to write a referral to one of our programs. And also, it might help with insurance costs, right? Having a doctor approve something may greatly lower the chance of a huge bill going to one of these sexual health clinics or seeking a program outside of here. So we can help with that too. And even within Dana-Farber, we have many different programs that can help with this. We have social workers that are here to counsel you all, whether it's you or your partners, around different strategies to try mental health treatment, maybe make recommendations on some medications or other programs and colleagues that we know. We have a sexual health program here. We know other sexual health programs in the community. And we also have the Zachem Center here, which is a place where you can go to have a more holistic approach to these things. So we talked about, you know, diet changes, exercises. We can help with those recommendations and give you a little bit more strategy around these things. But you just have to tell us. You have to be there to do it with us. So I'd also talk about some strategies that might help with all of this. So people talk about, not wanting to waste their time, or they don't know how to ask, or they don't know what to say. Write things down. Throughout your time between appointments, write down questions, write down statements, write down what's bothering you, and bring it to that appointment. It can take the burden off you to have to remember everything that you said. You know, I had this thought 3 weeks ago, but I lost it, or I didn't remember, or I couldn't exactly think about what it was. And then it feels like it's not worth asking. When things are written down, it can bring a lot of structure and focus to a lot of these appointments. It also might be worth requesting a longer appointment. If you're setting something up and you're only seeing a doctor for 15 minutes, 20 minutes, maybe ask the scheduler for a larger slot. That might give a lot more time to feel like you can sit down and get into really what's bothering you. It might not feel as rushed. It might feel a little more like teamwork in that moment. Also, there's a lot of ways to contact your doctors outside of appointments. We have the gateway, we have email, we have phone. Reach out to us beforehand and let us know that you want to talk about this in your next meeting. Look, I want to talk about this. It's something that's been bothering me for a while. And we'd be happy to do it. It also might be worth it to bring your partner if you feel comfortable with that. If this is something that you guys have discussed and have talked about and want to bring up, and your partner has input as well, sometimes it's worth having a team meeting around it. Have multiple people there to sit down and go over it and talk about what's really been bothering you. It might give a chance to get every perspective involved to find a better solution. Also, the power of just naming that this is a problem is really big. Hey, I'm really struggling with erectile dysfunction. Sometimes it seems like an impossible question to say or a statement to make to say, hey, can you help me with this? But just being able to say it out loud can break that glass instantly. That look, I already know it's a problem. It's something I want to work on. It's something I'd like to do. And bam, we can work on it. So, I did want to take also a couple minutes to discuss what do you expect from an appointment or what can you expect from an appointment? So, right away after this discussion, we might make a referral to the sexual health program here at Dana-Farber. There's resources online if you want to check it out ahead of time as well. We might make a referral to a urology clinic or a sexual health clinic that might be nearby you or has openings or is connected with one of us. We might know a colleague over there that that can work on these things. So that might be a referral to expect. They might refer you to myself or another social worker to talk about lifestyle changes, counseling opportunities. It might be a group, you know, just anything that we might be able to help with along this journey. And even if they feel comfortable and ready, they might offer a medication right there in the appointment. They might feel, look, it makes sense. You're safe enough to do it. I'm comfortable doing it. Let's give it a shot. And it might be just that 20-minute appointment might already have gotten the ball rolling towards something good. So, I wanted to talk a little bit about some takeaways. If you only took one thing away from this presentation, if it was this slide, I would be happy. If it was some of these statements, that would be enough for me. Firstly, you are normal. Feeling this way is normal. This impacts so many people. A lot of people are struggling with it, and you're not alone. It's a hard thing to do. It's a hard thing to struggle with. And we want you to talk about it. We want you to tell us. Another piece is that each person is really different. Something that works for one person might not work for you. The first try might not work. One thing might not work. But doing things together in combination might be the answer. Keep trying. Keep trying. And we have resources that can help. Another huge thing is communication is really the name of the game here. Communicate with your doctors, communicate with your partners, and even communicate with yourself. Take time, reflect on what's important to you, reflect on what's changed, what's been the most difficult thing. It might give you some insight into what we should start with first. Talking about it, planning together, making goals together, and tracking progress together is sometimes the biggest thing. And the last thing is that we're really here to help you. We want to know how you're doing. The reason we ask you how you're doing is because we want you to tell us what's going on. We have things that can help. We'd be happy to do it. And, I also wanted to just mention a few other resources, a few other places to check out, places to go with questions, concerns, and even have different programs there. Movember, the True North folks have, a huge amount of groups. They have events. They have articles about this. They have activities to try. Countless things throughout there. There's also Zero Cancer, which can provide similar to Movember, but they also have financial resources. They might be able to help with paying for things or bills. There's also the Prostate Cancer Foundation, PCF, which has webinars, guides. They have, everything from different stages of cancer to different treatments, from the journey start to finish. They have resources. And also us here at Dana-Farber, whether it's from our website, whether it's from me, whether it's from the Blum, whether it's from your doctors, there's resources around and we're here to help and we'd be happy to do it. So, I wanted to leave a little bit of time to go over some questions, see if anybody has any thoughts or ideas, or, just to talk about what's really resonated with you.
Thank you so much, Matt. That was a wonderful presentation. I certainly learned a lot of things that I've never thought about before. So thank you for taking the time to share your expertise, advice, and guidance with us. We have two questions. The first one is, what does the sexual health program look like at Dana-Farber, and what does it offer?
Yeah, so that is a great question. So it's run by a woman named Sharon Bober, and she runs it, and she partners with a few providers, a few doctors around this, so it can provide uh, counseling to folks for, initial referral. They can go over counseling about what's changed, what you'd like to accomplish, what you'd like to do. They can offer medications, they can offer activities, they can offer, more guides, as well as, instructions on how to use some of these devices, some of these medications, things like that. So they're often a really good place to kind of hone in on what you need and also make direct changes. So you might not get a referral. You'd get a referral to them, and they would be the ones to actually meet with you and go over strategies and go over what works.
Awesome, thank you.
Hmm.
And the next question is there a medication that works best?
Uh, so interesting. So I know we talked about kind of each person is different, but surprisingly, like the ICI injections that people go through are often really effective. They seem extraordinarily scary at first because the idea of injecting something into your penis is like terrifying to folks, but it might not be the first thing they recommend. They might say, say, Alice, let's try Viagra first. And then they might say, let's try the injections. Most people say they work. I would say 90% of folks say they work extraordinarily well, um, as well as little to no pain involved also. But they are something that I hear very good things about. So before jumping to like, an implant or a procedure or buying all this, extra devices or external things, I would try that. I would try the injections.
Awesome. Thank you so much, Matt. That was it for our questions today. As I mentioned earlier, the session was recorded and it will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. So really, thank you so much, Matt, for doing this presentation today, and thank you to everybody, for joining us.
Thank you so much for having me.